Om Swastiastu, good morning. We are from SGD B2, the first semester of PSSKPD 2021. Today, we would like to present our student project presentation, which title is Carbapenem-resistant Enterobacteriaceae. Before we start, I would like to show our members that will do the presentation. Here are our members. First of all, let me introduce myself. My name is David Christopher Tjandra. My last 3 digits of student number is 066. Now, I will explain about the introduction of this student project. The word bacteria has become a phrase that is identically heard as disease causing on humans, although only 1% of all bacteria that are able to make a person fall sick. There are a lot of pathogenic bacteria that are able to infect humans. Uniquely, there is a group of bacteria that work opposite to the treatment of antibiotics, which is named Carbapenem-resistant Enterobacteriaceae. CRE is a family class bacteria that is highly resistant to antibiotics. It has an ability to transfer its antibiotics resistance from one species to others. CRE has been a great concern for many people around the world. This is due to the high mortality rate, which has reached the number of 50%. That's all from me. Thank you.
Good morning. I'm Mahayana Putra. My last student number is 050. I will explain about the problem formulation, objective, and benefits. Next, the problem formulation. First, what is Carbapenem-resistant Enterobacteriaceae? How does CRA affect the clinical site? And what are the treatment options that are available? Next, the objective. First, to describe CRA. Second, to find out how CRA affect the clinical site and to know the treatments of CRA. Next. There's also the benefits. First, for the public community, is to increase public knowledge about CRA and its treatment. Second, for the institution, to adding a source of knowledge to improve the quality of learning material about CRA. And lastly, for the academician, this paper can be used for medical education resource and improving skill in literacy, conducting research, and gathering information from reliable resources. That's all from me. Thank you.
Good morning, I'm Devasya. My last 3 digits of student number is 068. Now I will continue the presentation. First, definition of carbapenem antibiotics. Carbapenem antibiotics are known as a group of antibacterial agents used to treat several bacterial infection and GNB infection. The emergence of carbapenem resistant strain has helped increase the rate of public transmission from medical facilities and making them a serious public health concern today. Next, definition of Enterobacteriaceae. Family Enterobacteriaceae is a group of gram-negative bacteria belonging to the class Gamma proteobacteria. Enterobacteriaceae can live in facultative anaerobic condition, and at 22 until 37 degrees Celsius, their growth will be optimal. It has the ability to grow on simple organic carbon and nitrogen compounds and carry out respiratory metabolism as well as fermentation. It is straight rod shaped and neither has nor forms pores. Enterobacteriaceae also cannot live in acidic condition. That's all from me. Thank you.
I'm Janice Wijaya. My last 3 digits of student number is 037. Now let me continue the presentations with the definitions of carbapenem-resistant Enterobacteriaceae, and I'll start with the main definitions. Some of the Enterobacteriaceae family has become resistant to carbapenem, or we can say that the antibiotics is no longer has its effects in combating infections that are caused by some types of Enterobacteriaceae. This is mainly known as carbapenem-resistant Enterobacteriaceae, or the CRE. Next slide. Bacteria has several resistance mechanisms to carbapenem, such as enzyme productions, which is the most likely to happen. The next one is the AFOX form and Pollens mutations. Nowadays, CRE has become a major and global public health threat that has also been concerned by healthcare professionals worldwide. Here's a data that shows about the amounts of infections, death, and what organism cause CRE the most. That's all for me. Thank you.
My name is Gusti Agung Saraswati. My student number 056. Now I will explain about class of Carbapenem. Carbapenem antibiotic can be classified into older and newer antibiotic. Older Carbapenem antibiotic are mepenem, meropenem, ertapenem, doripenem, diapenem, and pennipenem. Newer Carbapenem antibiotic, rhizopenem, tebipenem, temopenem, and saventrinum. Spreading mechanism, Carbapenem gains cold transfer from the long-term of metronidazole and imipenem drugs in hospital. Number 2, long-term hospital stays. Number 3, contaminated medical equipment. Number 4, hair contact from the healthcare personnel to the patient via hand contacts. Number 5, urine and feces. Number 6, pets and cattle. That's all for me. Thank you.
Good morning. My name is Yovilia Tio Yunus, and my last 3 digits of student number is 035. Now I will explain about risk factors. Risk factors that can occur due to bacterial resistance to antibiotics include 1. Encourage rational use, 2. Reduce unnecessary use for both prophylaxis and therapy, 3. This antibiotic selection process include dose, frequency, and caution to increase. Next, transfer mechanism between CRE. Bacterial conjugation is the transfer of genetic material between bacterial cells by a connection between two bacterial cells. It can be divided into 3 functional components that are coupling proteins, relaxosomes, and a type 4 protein secretion system. Next, during bacterial conjugation, DNA can be pushed out of one donor cell and transported to the recipient cell. It depends on a large membrane-associated protein complex belonging to the type 4 secretory system. Furthermore, the transport of ssDNA, membrane clusters, and periplasmic proteins are assembled together to form a large complex, which can be further subdivided into 4 different ways that are pilus, DOM components, periplasmic components, and IM components. That's all from me. Thank you.
Good morning, I'm Nevinne Nathania Susanto. My last 3 digits are 051. Now I'm going to explain about the clinical consequences of CRE. Next. In 7 studies of mortality due to carbapenem resistance, the mortality caused by CRE infection reached 26 to 44%. The mortality from CRE infection is more than double than of other Enterobacteriaceae. It was found that in patients with blood infections, CRE was higher in some Latin American countries. The mortality rate reached 30 to 70% and above 50% in Europe caused by CRE bloodstream infections. CRE-infected patients with comorbidities have high mortality rates with low clinical cure rates as well as low microbiological eradication rates. Next, PRC genetic aspects of CRE. CRE can appear through the different molecular mechanisms, especially through the production of carbapenemases that have genes that are mainly carried by large conjugative plasmids and facilitate the horizontal transfer of carbapenem resistance between different bacterial strains of the species. This mechanism involves the combination of mutations of porins and hyperproduction of MC cephalosporinases or extended spectrum beta-lactamases. Carbapenem encoding genes and mutation in porin encoding genes can be identified by using PCR. That is all from me. Thank you.
Good morning, I'm Komang Ayu Widhiani. My last 3 digit of student number is 044, and I'll continue the explanation from my friend. Based on the table from the journal entitled Genetic Diversity of CRE Clinical Isolate from a tertiary hospital in Eastern China, we can see that K. pneumonia, K. aerogens are Ornithinolitica, Aspergillus, and E. coli have carbapenemase encoding gene BLAKPC2, while carbapenemase encoding gene in E. coli is BLAKPC3. Next. And now let's move on to the next discussion, important disease and treatment option for the CRE. A family of more than 100 species of bacteria is causing various of several infections. Some of them are community-acquired pneumonia. This is an infection disease that can be the cause of death around the world. The main pathogen that became the cause of this CAP is Streptococcus pneumonia. Next. The second one is hospital-acquired pneumonia and ventilator-associated pneumonia. This is an infection in the lower respiratory tract that occur in patients that have been hospitalized for more than 48 hours. The VIP is a part of HAP that grow in ventilated patients. That's all from me. Thank you.
Good morning, I'm Nyoman and Medhira. My last 3 digits of study number is 070. And now I will continue the presentations. So the next disease is bloodstream infection, an inflammatory disease that is indicated by the presence of microorganisms and may appear by clinical symptoms, laboratory, and hemodynamic parameter change. Next is complicated intra-abdominal infections. Infection that occurs in the peritoneal can be diffuse and might be linked with some other condition like gastrointestinal perforation. Next. Last is complicated urinary tract infection. In the uncomplicated UT, it is found that more than 95% of it are monobacterial, and the most found pathogen is the E. coli. Next is the treatments. Some studies have found that CRE treatments that use the combinations of antimicrobial agents in vitro or in vivo may bring several benefits. Findings about this combination therapy are still so various that it is not possible to make a certain recommendation for the treatments of the CRE infections. So that's all from me. Thank you.
Good morning. My name is Marta, Lawi, and my last 3 digits of student number is 064. Now I will continue my friend's explanation about treatment options for CRE. Second, we have high-dose tigecycline. Tigecycline high-dose usage is the next most commonly studied method to know how tigecycline works actively against the antimicrobial agents that are associated with the CRE. Third, we have high-dose and prolonged infusion of carbapenems. It is proposed that a higher dose of carbapenem is still possible to reduce the bacteria amounts. The usage of high-dose prolonged infusion carbapenem can be considered if there are no other options available to the treatment. And the last is the new antibiotics. ceftazidime combined with avibactam. Second, B or B, meropenem combined with faburbactam. And the last is eravacycline, which is a synthetic antibacterial agent that has effective activity against the gram-negative and gram-positive bacteria. That's all from me. Thank you.
Good morning, I'm Fernando Ghosali, and my last 3 digits of study number is 036. Now I'll explain about treatment's outcome of CRE infection. The problem of treatment in the treatment of CRE infection is only with several antimicrobacterial options such as aminoglycoside, tigecycline, polymyxin, and fosfomycin. Using possible combinations, the effect of carbapenem treatment remains to be determined, such as high-dose infusion or dual carbapenem treatment. First is polymyxin or cholestyramine. Polymyxin works as a treatment by targeting gram-negative outer membranes through electrostatic interaction of positive charge polypeptide and negative charge lipopolysaccharides. The problem that polymyxin causes is nephrotoxicity and neurotoxicity. Second is tigecycline. Tigecycline works by inhibiting protein synthesis. The most common side effects are nausea and vomiting. The third is fosfomycin. Fosfomycin is a broad-spectrum antibiotic and is generally more well-tolerated. The side effects caused are mostly mild, and the most severe is phlebitis. The last is aminoglycoside. Aminoglycoside inhibits protein synthesis in bacteria and is still under development. The severe side effect causes nephrotoxicity. That's all from me. Thank you.
Morning, I'm Christine Edgar. My last 2 digit of student number is 045. Now I'll explain surveillance and prevention. Next. To accommodate a patient with CRE, healthcare facility should have the capacity to provide an isolation room for the patient, perform carbapenemase testing, and CRE screening tests. If the facility don't have the requirement, facility should identify other facility that could perform the CRE screening test needed. Next. In order to maximally control the spread of CRE, some control efforts are needed. First, hand hygiene, then contact precaution or CP, healthcare personnel education, minimize use of invasive device. Next. Timely notification from laboratory when CRE are identified, communication of CRE status for infected and colonized patient at discharge and transfer, promotion of antimicrobial stewardship, environmental cleaning. Next. Patient and staff cohorting, screening contacts of CRE patient, active surveillance testing, and chlorhexidine bathing. That's all from me. Thank you.
Good morning, I'm Ledwin Meikel Wibisono. My last 3 digits of student number is 061. Now I'm going to talk about our conclusion and recommendations. So our conclusion can be divided into 6 main topics and 6 main points, which are CRE or carbapenem resistance Enterobacteriaceae is a group of Enterobacteriaceae that are resistant to carbapenem antibiotics. And next one is one of the species of Enterobacteriaceae that is often resistant to carbapenem is Klebsiella pneumonia. Also, CRE has become a major and global public health threat because it causes hospital outbreaks worldwide. And the next one is CRE results in longer hospital stays, increased healthcare costs, mortality, and severe clinical outcomes. And for the next one is the mortality from CRE infection reached the percentage of 26 until 44%. And take note that patients with comorbidities have higher mortality rates. And the final one is there are several treatments for CRE infections, which are polymyxins, tigecycline, and fosfomycin, and lastly is aminoglycoside. And we move on to our recommendations. And for the recommendations, this topic needs to be studied by scientists or researchers, especially in the bacteriological field, pharmaceutical, and medical students. Finally, more knowledge can be obtained and various treatments can be developed in the future to cure and help all of the patients against the infections and spread of carbapenem resistance. That's all from me. Thank you.
That's all for our student project presentation today from SGD B2. Thank you for listening and giving your attention. We are very sorry if there are some mistakes during our presentation, and we hope that our student project can inspire and motivate lots of people based on its benefits. Lastly, I would like to close it with the Paramasanti, Om Santi 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 Om. Thank you very much.